Hi friends, welcome to classes by Lab Doctor. In our previous videos, we have studied in detail about the lipid profile, and today let us just brush up, or let us just see how can we interpret a lipid profile test. So when we hear about lipid, patients are usually scared. Our cholesterol is so high, triglyceride is this much, HDL is so much. There is always an idea that this lipid in our body is bad, but no, lipid has very much good functions in our body, and our body requires lipid for its normal functioning and metabolism. Yes, when the level of these lipids go beyond a certain rate, that is when it creates problem. So lipids are very much important because they are required for the body to give energy, for storing energy, for the cell membrane functions, for the hormones, for formation of phospholipids, for the absorption of fat soluble vitamins. All these will need your lipids. And lipid profile is important to know whether the lipids in your blood are in normal range or they are beyond the range. So whenever we say lipid profile, we have cholesterol, triglyceride, HDL cholesterol, LDL cholesterol, VLDL cholesterol, non-HDL cholesterol, cholesterol to HDL ratio, apolipoprotein A1, ApoB, ApoB to ApoA1, lipoprotein A. There are certain other ratios also sometimes included in the report. Your total cholesterol to HDL ratio, LDL to HDL ratio, triglyceride to HDL ratio. So the lipid profile basically comprises of all these parameters. Some labs categorize them as basic lipid profile, some labs categorize them as extended lipid profile, where they add all these, your ApoA1, ApoB, all these are added in your extended lipid profile. Because not in all patients we want to do ApoA1 or ApoB, etc. There are certain cases wherein the doctor feels that yes, we should get an extended lipid profile to know the risk of that patient, and then this is ordered. So why do we need a lipid profile? क्यों करना चाहिए हमको ये lipid profile test? One is for screening. Especially people who are above 40. Nowadays, people who are above 35, we want to assess the risk of cardiovascular risk. So for that, we need to know the lipid profile. If the patient is having symptoms, if the patient is having, symptoms on physical examination or in history, patient is having a history of chest pain, patient is having history of pain during walking, patient is having a history of weakness, paralysis, patient is having history of claudication, or on examination we see xanthelasma, xanthoma, corneal arcus, or there was a recent heart attack, or a patient had a stroke. All these will tell us that yes, this patient should undergo a lipid profile. And already patients who are put on statins or to reduce your lipid levels, to monitor how the patient is responding also, we need to know the lipid profile. So that is why we do the lipid profile. When you are interpreting the results, you should know why in the first place have you got that test done. So now, do the patient really need to fast for this lipid profile? See, earlier what used to happen, we used to tell that patient has to be fasting. If the patient wants to do a lipid profile tomorrow, he has to have at least 10 to 12 hours of fasting. Suppose if the patient got up in the morning, had a cup of coffee, and if he comes to do a lipid profile, we cannot reject the lipid profile. And that is because nowadays the studies have shown that post even without fasting also, if the patient is fed, still the lipid profile will be acceptable, and there is not much of a difference. Like some parameters like TG, VLDL, etc. might be slightly increased, but otherwise there is no much of a difference. And nowadays we prefer this post-fed samples for lipid profile also. So it depends on the laboratory. If possible, it is always you can give a sample on fasting, around 8 to 10 hours of fasting. So now the levels, the various parameters I have discussed in my previous videos in detail. We have discussed about each of the parameters. So I have a video for everything: cholesterol, TG, non-HDL cholesterol, your ApoA1, lipoprotein little a, every parameters there is a separate video. This is just to brush up for to you to understand that cholesterol levels, when we say we expect it to be less than 200. If it is between 200 to 239, we say that it is as risk, and if it is more than 240, it is higher. Like similarly, LDL cholesterol, it should be less than 100. If it is between 100 to 159, they are at risk, and if there are more than 160, the risk is higher. But remember, this less than 100 is for the ones who do not have any previous history of heart attack, stroke, etc. Suppose if there is such a case or such a risk, then we expect it to be much lower than 100. HDL cholesterol, we expect the normal level to be more than 60. In men, we expect it to be around 40 to 59, and in females, it is to be 50 to 59. So suppose if the HDL is less than 40 in men and less than 50 in females, it is considered as dangerous level. Similarly, your TG, we expect it to be less than 150 milligram per deciliter. Borderline would be 150 to 199 milligram per deciliter, and very high would be more than 500 milligram per deciliter. So you will be given all the ranges here, like you have cholesterol, it should be less than 200, TG should be less than 150. So all the ranges will be given so that you can get an idea where you stand when you see the results. So biological reference range will be given according to your age, gender also. We have the reference ranges, it will be given here, and it has to be interpreted in the same way. So whenever you are interpreting a lipid profile, so first thing is you will have to identify the patient who are having hyperlipidemia or a dyslipidemia. Okay, so dyslipidemia, I have done a video on this also, you can refer that also. Dyslipidemia is when the patient has abnormal levels of lipid in their blood. Okay, so it could be patient is having high LDL, low HDL, high TG, high cholesterol. All this will be comprising of dyslipidemia or called as dyslipidemia. So now the type of dyslipidemia, it could be primary. Now why this has happened? It could be primary. Primary is there is familial conditions, like you have familial combined hyperlipidemia, which leads to high cholesterol. Familial hyper-apo beta lipoproteinemia, there is a mutation in the group of LDL lipoproteins, and this condition arises from this mutation. Familial hypertriglyceridemia, which leads to increased triglyceride level, or there could be homozygous familiar or polygenic hypocholesterolemia because of the mutation in the receptors of LDL. So secondary dyslipidemia, this is more common than the familial dyslipidemias, like you have this obesity, excess weight around the belly, and because of diabetes there is secondary increase in the, or there is a deranged lipid profile. Hypothyroidism can cause, alcohol can cause dyslipidemia, PCOD, this is also a very common condition which can cause deranged lipid profile. Metabolic syndrome, patient is having deranged lipid profile, hypertension, increased belly size, the waist circumference is high, so there is insulin resistance, there is metabolic syndrome and dyslipidemia. Excessive consumption of fat, when you are having especially increased saturated fats, trans fats, patient is having Cushing syndrome, inflammatory bowel disease, severe infections such as HIV, and all these conditions can lead to secondary dyslipidemia. Especially if the patient is under risk category, we should definitely do this lipid profile test. Suppose if the patient is very obese, even it could be a child, we have to do a lipid profile. Patient is is having a very sedentary lifestyle, there is lack of physical exercise, patient drinks, he smokes, patient has type 2 diabetes, patient whoever is diabetic has to undergo a lipid profile, patient is hypothyroid, patient is having chronic kidney disease or a chronic liver disease, he's having digestive conditions, is after certain age. All these risk factors will let us know that yes, a lipid profile has to be done and we have to do a lipid profile. So second thing would be to assess the risk for atherosclerotic diseases, cardiovascular diseases. So when we assess the risk, we categorize them as low risk, moderate risk and high risk. Low risk is when the chances of that person getting a heart attack or stroke within the next 10 years is less than 5%. If the risk of that person getting a heart attack is up to 20%, he comes under moderate risk. And if that person getting a heart attack in the next 10 years is more than 20%, he becomes a high risk category patient or a extremely high risk patient. So there is a calculator by which you can calculate this atherosclerotic cardiovascular disease risk by putting your age, your gender, your race, your systolic and diastolic blood pressure. These are also very important. Your cholesterol numbers, HDL, LDL numbers, your diabetic values, your smoking, hypertension, treatment, everything is included and you can calculate and you will come to know your risk factor. This becomes important in another way also. See, whenever you are calculating or whenever you are interpreting the report, it is just not the numbers. It is just not your cholesterol, just not your HDL, LDL, TG. We take into consideration everything. What is the age of the patient? What is the gender of the patient? Does the patient have other risk factor? Does he have BP? Does he have diabetes? Whether he's on certain kind of a treatment? All this together we have to interpret the lipid profile. Just not because my cholesterol is 215 I will get a heart attack. No, it doesn't work like that. We will have to take all the risk factors and then calculate the risk. So this number, whatever you get for the lipid profile, has to be interpreted along with your other risks also, and just not one single number will not tell you anything about your risk of getting a stroke or a heart attack, etc. So remember, the goal of the treatment would be always to keep the parameters below the reference range. The cholesterol to HDL ratio should be less than 5, the LDL to HDL ratio should be less than 3, and the TG to HDL ratio should be less than 2. So what would be the message we would like to convey here is that whenever you feel or after a certain age and with certain risk factors, it is very important that you get a lipid profile. Secondly, the numbers have to be interpreted in association with the risk. Just one number will not tell you anything. So it has to be in association with your age, your gender, your BP, your diabetes, your other risk factor, your smoking, drinking, etc. All should be taken into account to assess the risk. So this was about interpretation of your lipid parameters. In case if you want to know about each individual parameters, I have made separate videos. You can check out those, wherein I have given you the normal ranges, the treatment, the lifestyle changes, the pathophysiology, the metabolism also of individual parameters, so that you can understand each parameters in detail. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.